Hi, my name is Dr. Mohammad Awais. Today we will discuss the brachial plexus, upper limb anatomy lecture. So you know that the brachial plexus is the collection of nerves and it is coming from the spinal cord. Right here in the middle we have the vertebrae. These are the cervical vertebrae and the spinal nerves are coming from the cervical vertebrae and makes the brachial plexus. So right here the nerves coming from the vertebrae. These are the roots of the brachial plexus. Then we have the right here is the trunks of brachial plexus, and after that, under the clavicle, there are the divisions of brachial plexus. And right here is in the axilla, we have the cords of brachial plexus. So the brachial plexus has roots, trunks, and divisions and cords. So in this slide, in the next slide, you can see that the portions of brachial plexus. So the roots are coming from the spinal cord, and then we have the trunks, then we have the divisions under the clavicle, and in the axilla we have cords. Each part of brachial plexus are present in the axilla. Cords are present in the in the axilla. So let's see the brachial plexus now. So in the picture right in front of you, you can see the brachial plexus. Its root value is C5 to T1, starts from the C5 nerve and ends on the T1 nerve. So first of all, we have the roots, the first portion, the roots of brachial plexus. Then we have the trunk of brachial plexus, and the third portion is the division, and the last one is the cords of brachial plexus. So the two nerves are coming from the the roots of the brachial plexus. Right here, the first part, roots of brachial plexus. The one nerve right here, and the one is right here. So the first nerve that is coming from the dorsal scapular nerve right here, the dorsal scapular nerve, that is the nerve supply of the rhomboids major and the rhomboids minor that are present in the back of this backside, and the attaches on the medial border of the scapula, and it helps in the retraction of the scapula. And the other nerve that is coming from the roots of the brachial plexus, this one is the long thoracic nerve. This long thoracic nerve is the nerve supply of serratus anterior muscle that are present on the lateral side of the costal region, and it is involved in the overhead abduction. So the nerve supply of serratus anterior is the long thoracic nerve that is coming from the roots of brachial plexus, and you can see that it is coming from C5, C6, and C7. So the long thoracic nerve root value is C5 to C7. And when this nerve will be damaged, it will cause the paralysis of the serratus anterior, and it will lead to the winging of scapula and the loss of overhead abduction. Then the second portion is the trunks of the brachial plexus. We have three trunks. We have the superior trunk right here, and the middle trunk, and the inferior trunk of the brachial plexus. So the two nerves once again coming from the trunks of brachial plexus. Right here, the nerve to the subclavius muscle. The nerve to subclavius muscle that is present underneath the clavicle, and the other nerve is the suprascapular nerve. The suprascapular nerve is the nerve supply of supraspinatus coming from the trunks. Then each trunk, the third portion is the division. Each trunk, we have three trunks: superior, middle, inferior. Each trunk gives two divisions. One is the anterior division right here, and one is the posterior division that coming from this part. Again, you can see here, this is the one division, and another division right here. And on the last, you can see that this is the inferior trunk and it gives posterior division and the anterior division. So later, these divisions makes the chords of the brachial plexus. So lateral chord, the posterior chord, and the medial chord. The all posterior divisions right here, the third portion divisions, all the posterior division makes the posterior chord of the brachial plexus. So what are the nerves that are coming from the lateral cord, and what are the nerves that are coming from the medial cord, and the nerves coming from the posterior cord? We will see that now. So from the lateral cord, we have the musculocutaneous nerve. The musculocutaneous nerve is the nerve supply of the anterior compartment of arm. That is the bicep brachii, the craccobrachialis muscle, the brachialis muscle. All right. And this nerve pierces the coracobrachialis muscle, the musculocutaneous nerve. From the posterior cord, we have the axillary and the radial nerve. They can ask you this MCQ that axillary nerve is arising from the which cord of the brachial plexus. Now you know that the axillary nerve is the nerve supply of deltoid muscle and it is present on the lateral aspect of the shoulder deltoid muscle and it involves in the abduction of arm. So that if the posterior cord is damaged, the axillary nerve is damaged, you will lose the abduction. After that, the radial nerve right here, you know that the radial nerve is the nerve supply of tricep region, the extensor compartment of arm, and the extensor compartment of forearm muscles. And its damage will lead to the wrist drop. Its damage will lead to the wrist drop. The radial nerve is most commonly damaged in the anatomical snuff box in the midshaft of humerus fracture. Now we will see the posterior cord. Posterior cord gives the medial cutaneous branch of arm that supplies the medial sensation. This nerve will carries the sensation of the medial aspect of arm right here. So this is the medial cutaneous nerve of arm. Then we have the medial cutaneous nerve of forearm. I was telling you it was coming directly from the brachial plexus and you can see that it is coming from the medial cord. This nerve will carries the sensation of the medial aspect of forearm. When you touches your medial aspect of forearm right here, the medial aspect of forearm, this nerve will carries the sensation. And the other nerve that is coming from the medial cord, that is the ulnar nerve. And it is the motor, it has the motor part and sensory part as well. So this ulnar nerve is supplying to the hand muscles, nerve supply, and it is also supplying the flexor carpi ulnaris and the medial part of the flexor digitorum profundus, the muscles of the forearm, anterior compartment of forearm. On the last, the lateral cord and the medial cord combines and it forms the bigger nerve, that is the median nerve. The median nerve that will be damaged by the supracondylar fracture of the humerus. It is also gets trapped in the pronator teres head and it's also gets compressed in the carpal tunnel that is present over here in the wrist joint and that leads to the carpal tunnel syndrome, CTS, and it will lead to the thenar atrophy, the thenar region muscle paralysis, thenar atrophy, median nerve. These are the MCQs that can comes from these nerves. So when you trace back the median nerve, it is coming from the all part of the brachial plexus and its root value is C5 to T1. It involves all the roots, like the radial nerve. So the ulnar nerve is coming from the medial cord. Right here, you can see that. So its root value is CA to T1. And the musculocutaneous is coming from, this one is the musculocutaneous right here. And it is coming from the lateral cord. And you can see that lateral cord, it making by the C5, C6, and C7. And C5 to C7 is the root value of musculocutaneous nerve. So this is the all is the brachial plexus. Now I will show you the labeled picture of the brachial plexus. So right here you can see that roots, trunks, divisions, and cords, four parts. The roots and the nerves are coming from the roots, the long thoracic and the dorsal scapular. Then two nerves coming from nerve to subclavius and the suprascapular. And then the bigger nerves, the musculocutaneous, axillary, and radial, and the ulnar nerve. So this was the lecture on the brachial plexus. Thanks for watching this video.